Hey, this is Dr. Ty from Premier Orthodontics, and in this video we're going to be showing you a before and after of a patient with an underbite treated with rubber bands. So as a reminder, if you haven't yet, make sure to subscribe to the video, tap the notification bell to know when we upload new videos, and make sure to like. So we'll go ahead and jump in here. So this patient, as you can see, has a pretty good underbite. The lower teeth are sitting in front of the top teeth. He also has a lot of crowding on the upper arch. You can see this canine tooth was blocked out, and this bicuspid in the back was partially blocked out. And the lower arch wasn't too bad. He's got a little bit of crowding. If you look at his molars, again from an orthodontic perspective, the molars are actually sitting in a good position. So his underbite is mostly a source of the upper teeth being crowded and they're set back, and the bottom teeth are in the correct position. So we take that into account when we decide how we're going to treat this patient. So again, the molars are in a correct spot. It's mostly the front teeth that need the most correction. So options for treating underbites include elastics, extractions, and jaw surgery. And looking at this patient, we didn't feel like his profile was bad. He had a good profile, so we didn't feel like jaw surgery was needed. When we were considering extractions, it was something that we did consider, but the reason we decided to try it without extractions was the lower arch was very well aligned with very little crowding. So we didn't feel like we needed extractions on that arch for sure for crowding. The upper arch was fairly crowded, but we decided we wanted to try this case without extractions first. And we'll often do this is we'll align the teeth to see how they look and see if extractions are needed after about 6 months in braces. It's a little bit more conservative way to do it. It's times where we feel like it may be a borderline case, and that was this case. So we decided to start with braces and rubber bands to help fix the bite and evaluate after 6 months if we could be treated without extractions. So the elastics that we used are elastics worn in this pattern. You can see when you have an underbite, and this is used more for a moderate to mild underbite, you can hook up the rubber bands. The bands will pull the bottom teeth back and the top teeth forward to help with that bite correction. So that's exactly what we used in this patient's case. So after alignment of his teeth and getting everything straight, we felt like we could get everything corrected without extractions, but we felt like the teeth did stick forward just a little bit more than we would like. So that's something that does happen whenever you have crowding, is that the teeth can start getting proclined or sticking forward. So in his case, rather than doing extractions, we decided to do what's called interproximal reduction, or IPR. And rather than taking out a whole tooth, instead we took a little bit of tooth structure off of each tooth. And this video will demonstrate how that works. So for interproximal reduction, we will take either a burr or a disc or a sandpaper strip. We'll basically take a 1/2 millimeter of tooth structure off of each side of the teeth. And this just makes tiny little spaces all around the arch. And once we've created this space, we'll then, using the braces, close the space. And this video will demonstrate that. So you can see there's just a little bit of space, and then we can pull those teeth back. So in this patient's case, after alignment of his teeth, we felt like the teeth were sticking forward a little bit, not so much that we felt like extractions were needed. So instead we did some IPR, or interproximal reduction, on the top and bottom teeth to pull both the top and bottom teeth back a little bit. And so looking at how his case turned out. So again, here is the starting pictures. You can see the underbite, the crowding, and the teeth were flaring out just a little bit, and after we aligned the teeth, they flared out even more. So we did that IPR like we mentioned. And here's how everything finished up. So you can see by the time we were done, the bite was fully corrected. The canines and the molars and everything else were sitting correctly. The underbite was totally fixed. We felt like his teeth looked perfect for his profile. Nothing was sticking out too far. We felt like this was a great treatment option for this patient. It definitely could have been done with extractions, and some doctors may have recommended that. Again, we were leaning towards that initially, but after doing it this way with the IPR, or interproximal reduction, we felt like we got a great result. So looking at the before and afters, you can see the change that happened. So you can see how much movement was needed to get this canine in. So we basically had to open up space here. And whenever we open space, that does flare those teeth forward. And that's when we did a little bit of reduction. So you can see the width of these teeth are just a little bit slimmer than the top teeth. And overall, we felt like this was a great result. So this was one example of an underbite treatment with rubber bands and interproximal reduction as well. Again, there's lots of ways to fix underbites. This was one example of how we did it. If you have any questions about underbite treatment, feel free to ask them in the comments section below. We'll do our best to answer. And if you have any questions about your specific case, I obviously can't see your teeth. I would definitely recommend seeing an orthodontist for a consultation. If you live in the Phoenix, Arizona area, we'd love to see you for a consultation. We can look at your teeth and bite to determine what is the best treatment option. There's not one way to fix every bite. There's lots of ways to do it. And this was our preferred method this time. So make sure to subscribe to the channel if you haven't yet. Tap the notification bell to receive notifications when we release new videos. And make sure to like and subscribe. Thanks so much, and we'll talk to you soon.